Record.
Anybody recording this meeting beside us, let us know now, please. Sue's gone? I'll read. Pursuant to governor, pardon? I'll just read the introduction and we'll wait. Pursuant to the governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines to remote participation can be found on the Office of the AG web page at whatever. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, in an emergency, a public body shall post as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format and shall contain the date, time, and place of the meeting and a listing of topics that the chair reasonably anticipates will be discussed at the meeting. Okay. There you go.
Talk louder.
Pardon?
Talk louder.
Okay, I'll talk louder. Let me see.
Or is it your microphone?
Okay, let me see if I got my volume up.
That's better, Jerry.
That better?
Yes.
Okay. All right. Some people say I talk too loud. Okay. All right. Everybody get the minutes of the meeting?
Yes.
Bill?
No, I didn't. I just saw now that they're in email. I haven't had time to look at them.
Okay, so let's, I'll take a motion to defer the approval of the minutes till the next meeting, till Sue can take a look at them.
Well, wait a minute. Did you look at them and did Jean look
Yeah,
at them?
they're fine.
I looked at him.
Okay, then vote on it.
Okay. Jean, you can make a motion to accept the minutes?
I'll make a motion to accept the Board of Health minutes from January 7th, 2021.
Second. Jerry, yes. Jean?
Yes.
Okay. That being done, public comment. That would be Mr. Didi. Any comment?
No, I'm good, sir.
Anything you want to talk about?
Nope.
Okay. Hey, Joe?
Yeah.
I'll talk to you later.
All right. You
Hey,
do that.
not a member of the board, but as the public, you want to defer your report to the COVID discussion, or is there anything else you'd like to speak about?
Oh, no, thank you. I'll wait till the agenda.
Okay. So we'll reserve any public meeting minutes to if anybody else comes on at my discretion. Madam Director, report.
Yes, Chairman. The Health Director's report for January 21st, 2021. Title V, soil evaluation witnessing. I just have, what's the word? Parcel numbers, but I did one at the Greens West, two at the Greens East, 125 Sheep Pasture Road, 63 North 8th Avenue, and 25 Birchwood. Suffice to say, I spent a lot of last week freezing cold outdoors.
So the only new ones are the greens, Tammy? I'm sorry.
No, green Sheep Pasture's also new.
Okay.
125 Sheep Pasture. It's just south of Edgewood.
Okay.
Yeah, really nice project.
So Tammy,
Let's see.
Tammy,
I approved plans for 19.
who performed them?
Say that again?
Who was the engineer? Or
The ones at the Greens were Barry Searle out of Southampton. The one at Shasher was Ryan Nelson from R. Levesque Engineers. 63 North Lake was also Barry Searle. And 25 Birchwood was Lori McCool. Let's see. I approved septic plans for 19 Veteran and 10 and 13 Overlook. The 10 and 13 Overlook are both new properties. I conducted a housing reinspection at 246 Feeding Hills Road, which was the property we had with hoarding. It's going pretty well. I had a variety of meetings, many of them regarding immunizations and the trainings for the programs for Prep Mod. Continue to go to the twice weekly public health interagency conference calls. I also attended a statewide call to the local boards of health for public health volunteers for potentially for clinics. And I attended the select board meeting last week.
And how'd that
And
go?
so that's my regular. What?
And why were you at the select board meeting and what went on?
I will go into it in my COVID-19 notes.
Good enough.
And Joe, you're the only one here for when I have the take it away select board member. So if for some that might have noticed in my last Friday COVID-19 update, or who noticed if they tried to come by town hall, that we've closed the north side lobby to the public. We're still open for, we're still available for, phone calls, online transactions and whatnot. But we had some potential cases and several close contacts pop up in the building. And we're taking every precaution to make sure that all of the employees and the public remain safe. It doesn't seem like there has actually been any transmission between employees, which is great. And I guess that goes to show that our COVID-19 protocols are actually working. They're good. They're great. I've also been talking to some of the departments to see if there's anything we can do to make their work situations more effective for them in regards to both the comfort of how they're set up and the safety. It's sort of
Tammy,
Yeah.
can the public go into the town hall?
no, it's
No.
closed.
It's completely closed.
Yeah.
Okay.
The lobby was the only place that you could go in before, and now it's closed. It
Okay.
will probably, we might reopen next week is what what's today? We
21.
might reopen on the 25th, but I'm going to, Monday morning, I'm kind of going to reevaluate it and see if it's a good idea or not. Just
So
based off of, I still have,
how long has it been closed to the public?
since last Monday.
All right.
Yeah, since last Monday. Oh, wait.
The Monday,
Yes,
Monday that
yes,
just,
last
by?
Monday.
Wait a minute, the Monday that just went by or the Monday
No,
before that?
The Monday before. So this Monday was the holiday. It was the Monday before we've been closed.
11th?
So almost 2 weeks.
Yeah.
Okay.
I think you're right. I think it's the 11th. Yeah. And it seems to be working out. We had limited access anyway, so I think a lot of people were already sort of used to it, and it was okay because taxes had already been collected and everything like that. I think that was a hard, that would have been harder if these things happened, obviously, a couple weeks ago, but it's been working out okay. So one of the things that the town's been addressing is the fact that the Families First Coronavirus Response Act, which requires certain public employers to provide employees with paid sick leave for specified reasons related to COVID-19. It expired on December 31st, and that the new spending bill signed by the federal government did not extend the expiration date of these paid leaves. As such, no employers were no longer required to provide paid leave for their employees. And so the select board, I know, has been working hard on coming up with a new policy to address the issues. And that's what I was able to sit in on the select board meeting to give my input, any kind of, I don't want to use the word expertise, but knowledge of the regulations regarding the COVID workplace and whatnot. And I didn't know if Mr. Didi had any updates. He's smiling at me.
I do not have any updates. There's no
You didn't
update.
have a meeting, right?
We don't have a meeting this week. We have one next Monday. We did appreciate you coming on. Unfortunately, we talked about it a week or two before, and I think we were blindsided that none of us even thought of you. So that's why we had you come on after the fact to discuss it. And I don't know if my board's going to reconsider how they voted last time or not. I was hoping they would. As of right now, they haven't. So we will see next Monday where we lay with all that.
Well,
Yeah.
I will just let you know that
While the pandemic continues to spread everywhere, it's affecting town hall.
It is. I'm well aware.
And I would love it if you guys keep the topic going.
Yes.
All right, let's see. Go into, no, we'll go into the newest stuff that came out today. So the newest COVID-19 orders, effective Monday, January 25th at 5 a.m. The stay-at-home advisory has been rescinded. And then effective Monday, January 25th at 5 a.m., the mandatory early closure of businesses is rescinded. This affects restaurants, indoor, outdoor recreation, everything that didn't have it. Gatherings can go on beyond 9 p.m. And liquor stores and retail establishments can sell alcohol past 9 p.m. And adult cannabis retailers can also sell it.
Well, my
And
question
the
is,
capacity,
my comment is,
I'm sorry?
does he not understand we're in the middle of a pandemic and the wave is going this way and not this way?
I am thinking that these restrictions, I think they realized afterwards were not the places that they
They were getting
Spread. Yeah.
I also think, Jerry, that the transition into clinics, vaccine clinics, has a lot to do with kind of
Okay.
increasing vaccines and decreasing limitations.
Just making a comment.
I do
Okay.
think there's a cause and effect, though.
I was surprised to see it just because we haven't, heard a lot of complaints about that. So, I mean, I'm assuming larger cities like Boston that probably make a lot more money off of nightlife probably have something to do with this, but I can't, I can't see what, what the good is in it, but I don't think it
So
really,
So the
it's not a
people
big, I
who,
don't think it really affects our town.
the people who spend that money after 9:30 at night and the people, whoever, they're the ones that were last in line for this vaccine, and they're the ones that still catch COVID. So these numbers aren't going to go down. Okay, I said my piece. I'm not the governor. Go ahead.
Okay, so I am going to share my screen. And hold on. How do I do this? Am I screen sharing right now?
Yep.
yes,
Okay. For some reason, I got rid of everything else but that. Oh, there we go. Dr. Johnson, do you want to take it away for the COVID numbers?
Sure. So I did this today to just kind of give a kind of a highlight of where we've been for almost a year. And obviously you can see the numbers and which months they were in, kind of a, here we are, March, and surprise, and then a little blip in April, and then it kind of slowed down going into the summer. And then as expected, we started increasing in November,
Excuse me.
December, and January. For multitudes of reasons. Obviously, people are gathering, and I can see it by addresses. I can see it by time. When I talk to people and they're not socially distancing, the ages, honestly, in the last 3 to 4 weeks have gone from 17-year-olds to
73-year-olds.
85. You're beat. Somebody's beat. So you can see, and I don't want to use this term, but within families, that's where the spread is. So if one's getting tested positive and then there's retests of other family members, then we're talking 4 to 5 in a household, which seems to be the trend. Obviously, December, January, not so nice, but January is, starting and moving up as we go up, and not expected. However, you'll see
What's
the
that?
line between December and January, and I put that specifically because that's when the rollout of vaccines started, mid-December for those phase 1 people. And so I'm going to leave that there to see how the trend moves over the next several months, because I think it's important to see what's happening around the vaccine piece and is it affecting our numbers. And I'm talking to a lot of people lately that really don't understand the whole vaccine process. So there's a lot of education about, can I get it after I've been tested positive? The whole site location in terms of if you get dose 1 at site A, you have to get it back at site A for the second, because that's how they're distributing vaccine. So a lot of education is going on now, not so much, disease management in terms of very mild or no symptoms in general, but kind of educating people moving forward.
I'm sorry, Kate, 1 second here, please.
Yeah.
I'm looking at this chart, and am I reading this wrong? December is 100, November is 115, December is 113, January is 19?
Whatever that number says. What does that say?
It's a 13.
I can't
think.
even read it, Jean.
Yeah, so it's, to me, this chart is telling me the numbers are going way down from December to January.
That January should be a 73.
Oh,
It should not be a
That's-
13.
oh, so that's, yeah.
And it's
okay.
a
So this
typo on
data
me.
is wrong then.
It's a typo on me. It should be.
And it's a graph error, too.
73.
Yeah, okay.
It's the
Okay,
draft error.
yeah. Faux pas on me.
That's okay.
73 for January.
I was confused. Thank you, Jean. I was confused about it too.
Yep. Nope, that's good. See, the fingers, we need eyes. I will correct that. Yep.
And we're not done yet.
No, we're not. I just, it almost seems like it's just part of being like an everyday, like I have certain procedures I do, a notification of fire and police, contacting people, and it can be very sensitive because I talked to 3 people today and I informed them of the results. They had not heard from the lab. And so you just never know who you're going to get on the phone. But that's par for the course when you're talking about testing, turnaround. I had one person get tested on the 16th negative, tested on the 19th positive. So, you know, they don't understand the timing of when to test, which is fine. But I do, you know, I spend quite a bit of time with people, and then their parents, if they're young, the parents get on the phone. So it's very important to educate and be that resource, and to say, call me back if you need information. Very important that we communicate.
Hey, where are people getting tested?
They're getting tested, Springfield, they're getting everywhere, CVS. I've had people go to different places outside of
Mhm.
Southwick.
Bradley.
Wherever they can, they will. Holyoke Community, still Eastfield Mall. Because when I get a lab test, I know where they're tested. I see some people testing, like, say, for example, Florida or Arizona before they fly back to get a test result within that 72 hours. So when I see that and I talk to them, I ask them, yes, did you get this test in that state? And now you're back home, and what that means, etc. So
So can they go on the Massachusetts site and find the testing sites?
Yes, you can go onto the
Yeah.
website and find the testing sites.
Yep.
Yeah, okay.
And the COVID vaccine clinics are there, they add every week. So if you see that map of Massachusetts, there's more sites, more added, you know, at least once a week. I check it daily, but you will see that the pharmacies are adding their sites, like Walgreens, CVS, kind of in the eastern part, but then you look at Pittsfield, you know, Trinity and Mercy, they're starting to really roll up in terms of access, and then eligibility, obviously, and then everything is, you have to register online. And some people are calling me to say, can you help me register online? And it's not a perfect phase in, depending on the site. So we just have to, you know, work with what we have. The supply and demand of vaccine is not really that straightforward. So we're going to be using Moderna. So when you get Moderna, you get 100, you can only order 100 doses at a time. So we have to think about when we plan a clinic, hopefully maybe end of February, if all goes well, knock on wood. We have to think about that whole process of who is registered, how do we process them through the clinic safely, and then how do we help them facilitate to come back 28 days later. So there is a lot involved, and there's resources. You know, it's one thing to be a vaccinator, but we're going to be using PrepMod that will help us schedule and then help us with vaccine inventory. So I've been learning about that, and Tammy's, you know, we're working on all of our agreements with the state to make sure that we're ready to do those processes when we do a clinic. So it's evolving. It's evolving. And when we get our dose, so we'll have to request doses, and then it really requires planning, because we have to have a clinic within 10 days of receipt. So the timing of it is very important as well. So we're working on how do we communicate, what's the best way, making sure we can fill spots, helping people if they need to register electronically, if they don't have a computer, whatever that needs for those residents.
And who will we be testing? Tier 2?
Oh,
We're not
vaccinating?
testing, you mean
Yeah,
Vaccinating, sorry.
yeah. I'm going to say, but again, tier 2 is, you know, it might start a few days early, right? It's just a guess, a guideline of when supply and demand happens. So my thought is I'm going to be away next week, but I've talked to Tammy to say, let's think about planning based on what we know about the clinics, how they're set up, how do we communicate, how do we get people registered, and then we have to staff those clinics. And we also have to prepare for emergency situations. So that means getting EpiPens and Benadryl on site, having a O2 stat monitor, blood pressure. So we also have to have emergency kit if need be.
And an ambulance.
Well, yeah, 911, get the AED. If that's what needs to happen, that's what needs to happen.
I'd like to have an ambulance right there,
Yes, I agree.
because I've heard at the hospital, some of the reactions people have been having.
Well, we can ask, sure. I mean, paramedics can vaccinate, EMTs can, pharmacy techs, pharmacists, certified medical assistants. Like there's a lot of people that can vaccinate. And if they're willing to come to clinics, absolutely.
Yeah.
And when we know
Chief Anderson,
those, we'll ask. Mm-hmm.
I've had many conversations with Chief Anderson, and he's more than willing to get involved and to get the EMS to help with vaccine administration, which is good.
I have
too.
a question. If we have to administer the vaccine within 10 days of receipt, where are we storing it?
The fridge and freezer, the Board of Health. We have a temperature log. We have a brand new thermometer
Okay,
that
and
will monitor
what's
those
the
temps.
temperature? What's the temperature of our freezer, and what's the temperature that Moderna requires?
We don't need to freeze it.
You can freeze it if you want. Once it comes out of the freezer, you have to use it. They're very, so the freezer range -13 to -13 to 5 degrees Fahrenheit. The fridge has to be between 36 and 46 degrees Fahrenheit. And we have set up a log that we will be looking at that before we get vaccine to make sure that it's going to be safe. We don't want to waste anything.
Is
Are
our
we gonna-
freezer manual
Sue.
or automatic defrost?
What's automatic defrost?
Well, just defrost by itself. You don't manually defrost it. Say, for example, at work, we can't put some critical reagents in a freezer that does an automatic defrost.
Our freezer,
This refrigerator was purchased for vaccine storage.
yeah,
No, wait a minute.
Whatever it is, it's
Is that the freezer that's been there since you came in, the refrigerator freezer?
I think so.
That's
I
in
don't
that
think
little-
it's been changed since I've used it.
And I've been
That's-
checking the temperatures ever since Kate got me on that one. I got new thermometers and everything like that.
Because as far as I know, that's the same refrigerator that we got when we first went into that office.
Yeah.
And it wasn't,
Maybe.
it was just
Works
a
good.
kitchen
No.
refrigerator.
Joe, what would it take to get it? Because what would it take to get a new freezer up there?
We
We
may
don't
not
need a
need a new
freezer though.
freezer.
We
Yeah.
Yeah.
So you think that's a good idea?
No, we may not need a freezer
Mm-mm.
if it reaches the temperature. And if you
Okay.
are gonna freeze it,
it's yeah, it's operating just fine. I mean,
So my question is, would it be
Two
helpful?
are
To have
not
a
freezing.
Okay, would it be helpful to have a
We
backup?
do actually have a backup. We do have 2 backups that I checked at the
Fine.
emergency operating center in the basement if
Okay,
need be.
just asking. Thank you.
Yeah.
so when we get the vaccine, will we be freezing it or refrigerating it?
Probably freezing first.
Okay, so my concern is if it's a freezer that does automatic defrost, can the vaccine be put in that freezer?
I don't think it does an automatic defrost.
It will never go out.
Do you
I
manually
don't,
defrost that freezer? Does
it
build up
will, it
salt?
won't go out below. Never.
You know, so therefore it must be on an automatic cycle. So you have to see if the vaccine can be in a freezer that automatically defrosts, or whether it has to be in a freezer that doesn't go through that cycle. Because in order to defrost, it goes through a warmer temperature and then down again. That's. all
I
I'm-
check it on a regular basis for the temperature, and I guess I'll have to stop using it if we freeze it. I also freeze my ice cubes in it.
So Sue, I don't understand. That means your freezer at home is
No, the
automatic?
freezer at work. You know,
I
the
know, but-
freezers now, they just automatically, they are defrostable by themselves. Okay?
Okay, so what's,
At work, our critical reagents, we cannot put in one of those freezers because the temperatures fluctuate. So if your freezer has to stay at -20, we need it to stay at -20. We can't have it going up to 15 and then back down to -20. So that's all I'm saying. Does it have to be at a certain temperature?
It has a range.
Okay,
So for Moderna, the freezer range can go from -13 to 5 degrees Fahrenheit.
okay.
And if it goes outside that range, then we need to let the immunization department know that that's happened.
All right.
I have never seen it, and we used H1N1 vaccine back in 2009, 2010. Never had a problem with it, but as long as we have backup, I agree, Tammy, that if God forbid something happened, we need to protect that vaccine.
I
Absolutely.
checked with Charlie Dunlap, and he has backup for us in the basement, which is good. I walk by the thermometers for the refrigerator all day long, and they fluctuate, but it fluctuates by no more than 1 degree.
Okay.
So it's
Pretty decent. Pretty decent. My iced coffee still tastes good.
are we going to give out the 100 and then hope we get 100 more for the same people? Moderna takes 2, right? They all take 2, right?
They all take 2.
So are we gonna give out 100 and hope we get the 100 for the second dose that comes on time?
yes.
So right.
We
So
won't even have to. As we were. Oh, sorry, Kate.
I was just gonna say the
This week-
priority is
Told us
get
that
as
you're not-
many first
Hold on.
Oh,
doses
sorry.
Give me that cake go.
by phase that we can. And that's driven by inventory and people registering. So there's a process about, there's kind of a time lag between your clinics and when you need to reorder so it can get shipped and then in time for your next clinic. And again, that 10-day window. So we're going to have to figure out how it's going to work when we start.
And given the fact that we're gonna do 100 people at a time, what are you gonna wait until 2025 to vaccinate the whole town? I mean, how's this gonna work? We're gonna get
No,
more
I don't think so,
supply?
because pharmacies are doing it now. I don't think
get
people
it.
are gonna wait.
Okay, all right.
Mm-mm.
So this is just so in other words, if Walgreens may get 1,000 doses and CVS may get 1,000 doses and blah,
Sure.
blah, blah. And is that right?
That's right.
Okay,
That's right. So we're just,
like,
I look
right
at us
now-
as a supplement.
one at a time.
Yep.
Okay,
I look at us as a supplement. If we can serve our community in a certain way where people may feel more comfortable coming to our site versus a pharmacy, then I think that and we're set up to do that. I think we have a responsibility to vaccinate people that want to be vaccinated.
Sue, what do you
Oh,
think?
Absolutely.
Jean? Jean's muted.
Can I ask
mean,
a question?
Mhm.
When we place our first order, we don't sequester the second order at the same time?
No, they won't do that.
Yikes.
They will not do that. They want us to first dose anybody we can. And then when we're ready to do second dose, then we request second dose.
Jean, are you okay with the town doing that?
Yeah, I'm a little vague on what the criteria is for selection though.
Well, it's,
For the
It-
phases,
Yeah,
we can
It's
send
pretty
you
well
that
spelled
link,
out.
Jean. It's pretty specific.
yeah.
Oh, I
Yeah.
am so sorry. I actually, hold on. Let me share my screen.
Hmm.
I have it actually up to do.
And remember too, Jean, it might change
Okay.
every week. So we kind of fly by the seat of our pants, knowing it might get tweaked depending on supply and demand.
So
So
where are
what
we now?
Phase one,
we are in
We're
phase
in
one.
phase one.
Yep, we will probably
congregate
be in
here.
phase one until the end of February.
So we had our first responders already got, our town's first responders, and everybody that wanted to got one. Is that correct,
Mhm.
Joe?
Hmm.
And a congregate care setting, is that, or the cottages, are they, and is that them?
Like group homes,
Yeah. And
group homes. Yep.
And how about okay, home care, healthcare workers? Anybody know in town if they've gotten any? Are we keeping track or?
I'm not sure about the VNA because we're not directly connected with them, but I'm going to guess Bay State VNA, any other private VNAs are going to be getting doses.
So I assume that the governor or whoever will tell us when we're gonna move into phase two. Is that it?
Officially, probably, yeah.
Okay,
Hmm.
So if you sign in or try to sign in to any of the mass or the regional sites, so like
UMass or Gillette
it'll
Stadium,
ask you
Mm-hmm.
where you fit.
Yeah.
or
need you to
if you even if you
identify.
sign into Mercy,
Hmm.
yeah, if Mercy and Bay State, the same thing.
Yeah.
So if you right now, if you fit anywhere in phase one, there is a place for you to go to get
Yes,
a
that's
vaccine.
right. Because when I went
Which-
there, I went on their website, I don't know, Sunday, whatever. They're starting on Monday, I think, at Mercy. But they
Yeah.
have a box underneath and it has
Yep.
all of these. And if you check, I don't know if they do it in order, but no phase two boxes are on there.
Correct.
So all the phase one boxes are on
Mhm.
there. So I assume they're just doing everybody in phase one.
And that's intentional. That's intentional. And I'm also hearing too, people are registering, but they're also canceling. And so in our when we use PrepMod, we'll be able to register, accordingly, like staffing, we plan it out, but we can also put people on a wait list. And those people, I would expect if it's possible and we have vaccine, that we could call those people, get them registered on site and get their first dose in. So there is a process in PrepMod in terms of registration, wait list, contact them and get them into the first dose clinic, which is very, very important. We don't want people hanging out there, wondering where they're going to get their shot. So, we just have to be flexible. I guess that's the most important thing. We have to be flexible, expect people not to show up. We can wait list them. We can call people, come in, if you're in that particular phase, we'll vaccinate you. They're very, very strict, and they're going to be strict about the pre-screening sheet. So when someone registers online, they get a screening sheet a couple days before their vaccination. They have to bring that with them, and it needs to be reviewed by a clinical person for first and second dose to make sure in terms of reactions, first dose, second dose, anything like that. It's reviewed by a clinician, and that's part of the process of bringing people into the clinic to make sure that we're, looking at their history. It's very, very important. So many, many rules to make sure that we're keeping people safe God forbid, if there's a reaction, we know how to treat it, manage it, call 911. And then the follow-up is a vaccination adverse reaction form that we're responsible for helping those people make a request to. So it's a national database with the CDC, and I hope there's no adverse reactions, but we're responsible for helping those residents make a report, which they can do online, or if they can't, we have paper copies. Joe, what are you thinking? Joe's like, ah. It is a lot of detail to make sure we vaccinate people safely. And I think we're just in this middle kind of wave of, people still testing positive, managing them, educating them about the vaccine, and then the slow kind of wave to the clinics based on phase. So we're in that part now. We're in that transition part. Other
Oh, I do have a
questions?
screen about where we are now. Where'd it go?
Hi, Doug.
Hello.
How are you?
Good, thank you.
This is kind of like where we are sort of right now in the phase. It's a little heavy, the different things, but it kind of shows like how, we're still in phase 1. So we're not expecting to see some of these other groups really to get hit. Oh my God, that sounds horrible. to move on to until the beginning of February, like the home-based healthcare workers and the non-COVID facing healthcare workers.
Hey, do we get any kind of statistics of like how many people in Southwick get a vaccine? Will we get it?
we will when we start
I think
doing clinics.
go on the, if you go on, like right now, if you go on the state's website, you can see like how many based off of like, I think
These sections
Mhm.
have been vaccinated.
Yep.
I
By
don't think they
county,
put
I think.
else up though, have they, Kate?
Yeah, I think it's by county. They roll them up to county. So we don't know, or I have not seen individual towns, but they roll everything up to
Yeah.
county.
I-
And you can see where the numbers are.
What's the purpose with the arrows on the left?
To see where
that's
we
what they're
are.
working on right now.
Mm-hmm.
So that means we haven't done any home-based healthcare workers yet?
I don't think that's an absolute. I just think that's like where the main focus is.
February.
Yeah. I'm sure there are
Like in
home-based
certain
people.
areas,
Yeah.
yeah. Like so when you request your vaccine and you're say working for a particular group on this list, so say
I requested my vaccine for first responders, and I went through my first responders, and now we're done, but I have doses left. I can now move on to the next set. So I could say, okay, congregate care, I can move there. If there's nobody, if that's already being taken, you can move on to home-based healthcare workers. They do not want you to jump a phase, but they do want you to at least move to the next level. So say for an example, we had, for phase 2, we vaccinated, 75 and up, we could move on to the next. If we had some left, we could move on to the next group in that.
Okay, I think, did Jerry ask this before? So the home-based healthcare workers, those categories there, who contacts them, or are they just supposed to know that they're eligible?
Their
They're
organization would.
Okay,
They say health, they know what's going on. Mercy Medical, they know what's going on. So it's the umbrella trickling down to the face. Absolutely, because they want those home healthcare workers in the homes. They need to be in the homes. of
and
people.
so and for the organizations that contact me, I direct them to a link for healthcare providers, and they can either request their own supply to their staff, or they can find a location for them to send their staff to.
so how does it work for, like private people that come in and take care of somebody that don't work with a company?
They could go to a vaccine.
They would go to a
site.
regional site.
Yeah,
They could go to one of those sites, okay.
absolutely. They might have to travel a little bit, but they would not be turned down.
Okay,
You know, honestly, I would travel 60 miles to get a vaccine, knowing that I have to travel 60 miles again, but it's okay. People are willing to travel if it's not local.
And what's going to happen is then everybody who's eligible for a vaccine isn't going to get it, isn't going to want it.
right.
That's true.
I was at Bay State today, and a nurse looked me in the eye and said, and she was giving me the monoclonal antibodies, and she looked me in the eye and said, I'm not getting the vaccine yet.
Mhm.
And here she was in direct contact with two people who were positive for COVID.
Yeah,
She was dressed up, and she had to change her gloves 100 times
Mm-hmm.
to administer these antibodies.
Right.
And she looked at me and she said, I'm not getting it yet.
Yeah.
And I almost said to her, well, I can't. Okay, Peter's not here. I said, you are crazy. But, you know, I'm not going to tell her to get it, but
Take
she
your
said,
chances, right? I know.
it's a big chance. This is no fun. This is not a fun thing to get.
Mhm.
Trust me. It's not so much the symptoms that you have. I'm recovered. Eileen had a hard time with it, but these antibodies really turned her around today. And so because she was hacking a lot. But it's no fun. And we need to get the word out. This is not just the flu. And it's not so much it's the disease, it's the mental stress on where's it going to go.
Mm-hmm.
So I think it's incumbent on us to still stress it. So, but I mean, my point is that there are some people, and this person is highly educated, and she's right there in the middle seeing people dying every day. She does not want to get the vaccine for a couple of months or 3 months or whatever.
Mm-hmm.
And that's fine. It means somebody else is going to get protected and she's not. So I think that's what's going to happen in town. There are a lot of people who are just going to say, I'm not going to get it.
Right. And that's okay.
Well, it's fine with me.
And I mean, thank goodness the people that have tested positive, right? They already have some antibodies going on, which is not, what are we at? 375 cases. Is that right? And then never mind herd immunity. So yeah, I think it's going to be very up and down based on where people are at that time. And that's totally fine. Like if someone came into a clinic and they registered, you review and they leave, that's okay. Because that's their decision. So you just never know who you're going to meet. We have to accept them for where they are. And that's okay.
Okay.
That's well said, Kate.
Thank you. Should I read my my poem? Is that appropriate?
Depends
I
what you-
loved it.
Go ahead, Kay, read your poem.
Okay. So I had a moment of poetry clarity today. I'm not a writer, but there was something very heavy on my mind. So I decided to write a poem. Joe, don't you fall asleep on me. Actually, I could say it to Joe because it kind of reminds me of the basis of the poem, but I'm going to read it to you. And it's very heartfelt, but I feel it's like an expression of what we've been through as a community. Very important. So just bear with me. It's called "'Twas the Week Before COVID." So 'twas the week before COVID, and all through our town, not a resident was stirring and no gloves could be found. The first case of COVID was a scare for us all, but we jumped in together and planned a long haul. One case, then 3 cases, and then up to 4, made the town nurse quite nervous, and she prayed for no more. The spring seemed to come with a small bit of peace, and summer activities gave us memories so sweet. Back to school after Labor Day was a planned glory, but the increase in cases made us all worry. Now, Halloween, Thanksgiving, and events in between, we encouraged family gatherings to stay socially distanced and pristine. Our team faithfully hunkered down during the surge after all. With more cases upon us, we kept making calls. 2020 is finally over, so let's breathe for a minute. The next phase is here as we plan our clinics. 2021 is a brand new start, and I am grateful to all who share their hearts. So thank you, yes, thank you to all of you here. Our town is so fortunate to have employees who care.
Well, thank you, Kate.
Hey, can I request that be put in our Board of Health report for 2020 for the year?
I'll second that.
Yeah, of course, whatever. It's just so,
You don't
it's
mind,
so
Kate?
personal.
Kate, if you don't mind.
No, I don't mind.
Jean?
I don't know. No, I don't mind.
Okay, got a motion to include that in our Board of Health report for town?
Yeah, that's all we'll put in is that.
It just
Well,
says a lot.
I won't argue with that at all.
Okay, so Kate, if you would share that with Tammy so she can get it in, that would be perfect. Thank
Hey,
you.
Kate, are you going to post that on social media?
Mm-mm.
No? That's
I-
good. Very
Can we
good.
put it on the town website?
You can do whatever you want. I had to send a message. I never thought I would write a poem like that, but it's just very important what our town has gone through. And we need to recognize that this is hard work, hard decisions. It's not easy. And every town goes through these, I think, emotions of what's happening with people in our community. And I think the greatest thing that we have been able to do is to be loving
I'm lucky.
and lucky. I wouldn't want to do this every
It's
year, but
really-
you know what? I feel very blessed that I actually went through this. I do. I really, really do. Because it
It's
helps
really
us understand
playing
and
field,
reach
hasn't it?
out and help more than anything else. So you can do whatever you want with it.
Okay, thank you.
Of course.
Thank you very much, Kate.
You're
Hey,
welcome. I'm sorry for crying. I can't help myself. But
We can't see you.
that's okay. You don't want to see me. I'm blubbering.
Oh,
Hey, Kate, done a wonderful job. Thank you.
yes. Hey, I missed the part, I guess I wasn't paying attention, about what was going on at the selectmen's meeting that Tammy attended.
They were talking
Oh,
about.
we were talking. My internet connection is so bad. I don't mean to be talking over everybody, but I start and then everybody starts back up.
So what was it about?
Tammy,
Hold on, let me get my notes.
Joe, you want to jump in?
Sure, we were just going over the whole COVID with the, I'm going to say state or government decided not to fund some of the things they were funding. The select board made a decision a few weeks before about a few things. And quite honestly, we were blindsided that we kind of forgot to talk to the boss, Tammy Spencer. She runs the town now until COVID is over. It's her little town. So I reached out and said, Tammy, could you please come to a meeting? Because not that we had questions, but we wanted to get more of an update of where we really are and how things really work. And if someone is or isn't sick, is she basically came out to be that she's kind of like the glorified school nurse. So every day, certain individuals of town may or may not come in front of her and say, does this work? Is this little thing okay? And Tammy says, no, here's a lollipop. Go back to the math class because that's where you need to be today. So, we learned a lot about what she really does other than some perk tests and bust someone's balls over their food establishment. She does a lot more than that. So we got educated on realistically what she does and how she really is in charge of who does or doesn't come to school or work that day, should they have a COVID symptom or not have a COVID symptom, or what someone might think is a COVID symptom and isn't. So we got updated on that. We had made a decision on some things to do with COVID and the way things are paid or not paid if they're out sick. And that's pretty much the nutshell of it. And then the Board of Selectmen will relook at what they made decisions on, then they'll go from there. How's that?
Sounds good. So Tammy, when you get invited to another meeting, will you let us know? Because we might want to zoom in, also, if you're going to be there.
Oh, okay.
Okay?
It was very spur of the
Make sure
moment,
you
wasn't
bring
it?
your posse, Tammy. Bring your posse next time.
Yeah.
Gotta
Yeah,
bring the posse.
we want to protect you.
Well, that's
Can they-
one.
Oh, believe me, I think we need to bring people to protect Joe and I.
Yeah. I don't think
Tammy
that's the
does
case.
quite well,
I
and
was
that, no
very
insult. No, you are, of course, but
At that meeting.
yeah, but I feel when we're in a meeting
No.
with Tammy that I brought a
Meeting,
knife to
though,
a
it was
gunfight. You know
it
what I'm
was-
saying? Right.
You
You
know where
don't
we-
mess around, Doug.
No,
You don't
she's
mess around.
no, she's right, and I'm sorry to jump in, but Joe was a little more colorful than I would have described it, but
Sorry.
totally my fault, right? We were presented with a tough personnel situation and with the end of the FFCRA for public institutions. Private institutions have a different way of handling those expenses. So we said, okay, you can use your sick and vacation time if you're quarantined or positive or what have you. And apparently I am the eternal optimist, and I would never think that someone would actually come to work with COVID because they didn't want to use their vacation or sick time. And Tammy showed me the error of my ways, that people are not as altruistic as I would just like them to be. And so that we would have a bunch of sick people in the building infecting everyone else and wiping out town hall. So not that, so we're going to revisit that and make sure we do it correctly. And there's some union agreements and stuff that are not subject to this stipulation of
You mean
policy, but
they knew they were positive and they still went to work?
no, this didn't happen. It's just, for instance, for happenstance,
Oh.
if we institute a policy that says, because you can no longer get paid sick leave for quarantine or isolation, and you can use your sick time or vacation time for it, or if you're, et cetera. But
I get it.
it almost begs the question of, would someone actually come to work when they were exposed or even potentially sick with COVID, but because they didn't have the vacation or sick time, or they didn't want to use their vacation or sick time for being sick from COVID? and potentially have an adverse impact on their surrounding coworkers and the
Really?
public. So, well, I would tend to think that that wouldn't happen, just me being an eternal optimist, but the fact is it would happen. So
Would
we're going to revisit it and discuss it. And, so we're going to revisit it and discuss it. And Tammy was nice enough to come in and show us the error of our ways. And we should have reached out to Tammy first. We should have. That was my mistake. Right. And it would have been fixed up front. Like I said.
Right, Sue? You all set with that?
I'm all set.
Okay.
2 different versions, yeah.
Okay. One the professional and then you.
Well, no. I mean,
That's all good.
Joe's description was more accurate of what went on, but it was I'm taking responsibility as the chair because the
Yeah.
policy was put in front of us and we were already past the date at which the FFCRA had already expired. So we thought we should have done something. Apparently doing something was the wrong thing.
Kate, are you all finished with your report?
I am, unless there's any other questions.
So how
Jean?
many positives since the last meeting? In the past 2 weeks?
Let's see. So the report from DPH, we went from 343 to 365.
22.
I can't do that in my head.
Yeah, I know. Total tests in the last 14 days is 893.
Oh.
So we have a 7.28% rate,
That's gone
which is
down.
down 2%. And Hampden County, as of yesterday, was 9.39. So we are definitely much lower from Hampden County as we were from the last week of reporting, which is good. I mean, there is a trend kind of creeping down, but
So
I
I
don't
think
put my hat on it.
I think the light at the tunnel is not a freight train anymore. I think that we're seeing a coordinated federal response starting up. At least that's what I'm feeling. I don't know what you people are. Tammy, is that what you're thinking?
You kind of went in and out. I didn't hear it.
That there's going to be a more coordinated federal response to this now.
I would like to think that, but I'm not feeling it at this time through everything that's
It's
been.
been 2 days, so. Okay.
Yeah.
So tomorrow morning, there might be in our update with the state, we might get some new information, but we seem
Yeah.
to be getting information all the time.
Okay. Anyways,
But so far,
you have anything else, Tammy?
no.
Tammy? Kate? Joe?
Budgets, make sure you get that budget in on time, please.
Yes.
Sorry.
I
I can say it in a
spoke with
poem
Terry-
if you want, but I'd rather just tell you to get your budget in.
No.
Sue, have you seen a copy of the proposed budget?
No, have you sent one out yet, Tammy?
No, and I am glad you said that, Joe.
Oh,
I
what was that?
didn't write it down, but I
Is that a
did want
bus?
to talk to you guys today because at the last, thank you, Joe. At the last meeting, there was a few things we talked about, and now one was the immunization line item, and you guys were like, we're already asking for a little bit. Let's not ask for too much more. But when I spoke to Terry Mish this week, he said, yes, ask for more if you want more. So that's why I wanted to bring it up. And
My guess is that we can put down probably a lot of figures in the select board and finance if it has to do with COVID, and we'll get it.
And even if you'll get it, but we've always backed you guys with this whole COVID thing. You know that, Jerry.
I know
So-
that, Joe. I'm not
so-
worried.
And I'm with you. Yeah, put the number you got to put down, and God forbid if we need more halfway through shots or whatever, you'll get it. Absolutely. You know that. Yeah.
Tammy, I think Sue and I and Jean would like to see.
So I mean, if we did want to bump up our,
Or what? I'm losing you.
yeah, I would like to get a Wi-Fi signal booster as part of the budget. Can't see. But if we did want to bump up the immunization clinic line, he said this is the year to try to do it.
But just put it down. If we don't
What
use
you
it, we'll
think?
give it back.
Right.
And if
Like
we
from-
need more, we'll get more.
'cause
That's
it-
all.
And some of the COVID stuff is reimbursable under FEMA or under CARES. So
Mhm.
even if it carries into this year's budget,
So I think if you send it to us,
Yeah.
we can discuss it at the next meeting and then we'll approve it.
Yeah, the things that I'm a little worried about not getting reimbursed for are the what do you call them, Kate? Like the medical countermeasures in case we have reactions and things like that, like the EpiPens and the other stuff. Like that's the stuff that
Oh,
I'm
the emergency
I'm worried.
management stuff?
Yeah,
You don't think they'll pay for
like
that?
There was a fine line in some of the things for what they pay.
well,
Okay,
Like bodies, like paying for like salaries and things like that is one thing.
Yep.
We don't have to pay for the vaccines and we don't have to pay for the syringes and things like
Yep.
that.
Yep.
But there
the
might
people,
that might not end up falling. Cause I tried to do a few things like tents and stuff like that didn't fall under that money. So that's why I thought if we at least had that room in case it didn't, we could put that in an immunization line.
So if we don't get reimbursed, you pay for the EpiPens and then if you use them up, you buy more.
Yeah.
You need them, you need them, you can't
I-
worry about it.
I thought,
Yeah,
EpiPen is real expensive.
I get it. But what I,
it is. It's $341.
for two, Tammy?
Yeah.
Listen, you have to have them.
Right. Just
So-
like in a school health office.
Yep.
You
You
have to have them.
You have to have enough.
And they
So,
might expire and they may not. It doesn't matter.
Okay, can I say something? What if
yeah, so
Kate and Tammy get together, figure out what to put in there for a figure?
I have one. It's I want to say so 341 plus 180 something. It's gonna go over our 561.
it's fine. Just
Hmm.
put it in,
yeah,
Okay.
Wait, and
send it along.
And everything else is level funded, right?
Except for Kate. Kate, we're bumping Kate up.
Oh, okay, well, that makes sense.
That's fine.
Yeah.
Now,
Everything
I don't
else.
think so. After this, we don't need a health nurse.
Thank you, Jerry. Can you take over my job?
well, but now we have
Please?
Okay,
Not going anywhere.
I wouldn't take over your job for all the whatever in China.
well, now you have a town poet too, so it must be worth something. But
Yeah.
getting back
Thank
to
you,
the
Jerry. I appreciate that.
budget, from what I read on some of it, Tammy, and I don't know where it fits in. And usually in the budget, we don't look at the revenue side, we look at the expense side, right? Because there's all kinds of revenue buckets, but on the FEMA, CARES, et cetera, the overarching principle was an unanticipated expense that you wouldn't have expended but for COVID. So if you were gonna buy 2 EpiPens to have in your health office already, and they were budgeted, you can't do that. So it's two sides, right? If you budget for these things for COVID, they may not become reimbursable. So you have to be careful with that. If you budget for them and you get the money and then you get them, you can't claim the reimbursement. But if you do go and get them and procure them, then you can claim them under, because we wouldn't need 2 EpiPens at an inoculation site, because we wouldn't be having an inoculation site but for COVID. So that's why I just want to put that out there.
So how do we do that, Doug?
Huh?
How do we do that?
How do you work around that?
I don't know. Like we went out and bought some equipment that we needed in town hall in case for PPE, we bought some technical stuff in case we needed to distance employees. Totally eligible, wasn't budgeted, wasn't forecast. And if we don't get it, we're gonna have to scramble to find the money to pay for it. Not from the nurse salary, but
Thank
you
you,
know,
Doug.
well, just check.
Thank you.
So
But we'll have to find the money to pay for it, but we are pretty confident we're gonna get that money back.
So we can actually buy the EpiPens now and
Yeah.
anticipate, we
Yeah.
can buy them.
If you think you need something, and I don't want to speak for Joe, and we're not in a meeting right now, but we've backed everyone's play on with the Board of Health and as far as pandemicness and what supplies you need and so on and so forth. And whether we can claim it from FEMA or not, and you're talking $1,000 for a couple of EpiPens all in and plus some other stuff, I don't have to go, lay off 5 people at the library or something because we didn't get reimbursed this money, right? This needs to be done. So we'll get.
So how many EpiPens would you, Kate? Would you?
Hopefully we wouldn't need more than one, right?
We need 2 adults. Just to, yeah, because you don't know. I mean, anaphylaxis is unpredictable.
No, I get it, but
And I think they come in 2 packs.
Hey, also, does the ambulance carry them too, the EMTs?
Oh, I'm sure they
Carry 'em in
do.
their ambulance?
Mm-hmm.
All right.
And Jerry
Yeah.
will bring his own.
All right, just make sure you check the outdates.
Yeah,
That they
yeah,
last
of
through
course.
2021.
Yeah.
'cause
I just
if you
feel
don't
we
have them,
to
you can't
a
run your clinic.
We have to run a clinic independently. Like I can't rely on an EMS guy bringing EpiPen to site. We need to do it on site when it's happening. It's just
go
like
out and buy
waiting
two.
to do CPR.
Just go out and buy 2 EpiPens. Okay? How's that?
And I'll work with Carl tomorrow to get that resolved.
Thank
End of
you.
discussion.
Tammy
Okay,
can do.
let's move
Tammy-
on.
I have a quote for all, like Kate, it's
Yeah.
Kate's dream list, clinic
Mhm.
list, and I got quotes from,
I think Doug's frozen.
Mass
Surgical.
Medical.
Hold on.
They're actually very
Doug?
reasonable.
I just have a question. Are we actually going to have to run a vaccination clinic in the town of Southwick? Or is this going to be done at CVS or at Holyoke Mall at the former Sears?
Kate went through this and she
I'm
feels.
sorry, I was late. I was at another meeting.
Well, hey, what's important?
Well,
I
Okay, anyway.
absolutely do. If we can get vaccine, Doug,
yep.
I believe it's our service.
Oh, I do too, but I have
To
all the talk I've
offer-
heard has been doing it either at, Holyoke Mall and CVS and everything else. I thought we had been talking all along about it. I thought maybe I missed a
Mm-mm.
memo.
I wasn't even sure the pharmacies were gonna get it. I didn't know how that was gonna roll out.
Hold on. So we talked about this earlier and the board decided that it would be in the town's best interest if we held a clinic to vaccinate people against COVID-19.
I'm
So,
with you. I'll be the
Okay.
first in line because
Right,
then they know they'll have the EpiPen.
right.
But doing this 100 people, is it really worth it?
yeah,
Yes,
it's worth
Yes,
it.
it is.
Just to do
Yes.
100?
yes.
Well, you're gonna do 100 at a time and then you get 100 more.
A
I think you
100,
run it-
200.
I think you're running
Yes, it
12
is.
hours a day till everybody's done.
I think you're right.
We run our clinics 9 to 5, 9 to 6, whatever it takes.
9 to 9.
9 to 9.
'cause we
It's-
still have to
Whatever.
think about, the town as an employer that employs critical infrastructure employees that aren't first responders.
Mhm.
And that is something that employers have to handle. So,
I
we
think the
have
optics-
deep,
I think the optics for the town look excellent if we hold the clinic and get as many people vaccinated through the town as needed, because this is not like the flu vaccine that rolls out that you can go into Walgreens or CVS for 8 months at a time and only 50% of the people do it.
Mhm.
So I think it's important for us to do this. I don't think it's important to do the flu clinics because I think they were available.
Right.
We don't know if Walgreens in Southwick is going to get 100 doses. They may not get any. But if
Yeah.
we're guaranteed 100 doses the first round and then 100 something, I think we should use them.
Yeah.
For whoever is
Good plan.
prioritized first. So we've already decided that. So
I hate to interrupt here, but for a
Okay.
second, if you don't mind, I have an issue. I need to leave the meeting now.
okay, Gene.
Okay?
All right, Jean.
Good
Thank you, everybody. Have a good
Thanks,
night.
You too, Jean.
Jeannie, okay.
So
Go.
Tammy, will you send us a copy of the budget, of the proposed budget?
certainly. Yes,
also-
certainly.
At our last meeting, we talked about the restaurants, the ones that are reduced their seating. And you were gonna send us a copy of
Yeah,
those restaurants?
I
Tammy,
did not have a spare minute to finish that, Sue.
Tammy, what have you been doing? I'm only teasing, what?
It's over on Monday anyway,
Let's
isn't it?
see. This week alone, like, let's see, between the 15 hours of perk
No, I'm
tests
only teasing
and
you.
yeah. Coming up with a standard message for all the departments to give to handle the hundreds of phone calls about vaccines.
Yep.
So, although I did ask permission to steal parts of it from Agawam, Agawam put out a message about, about the rollout of the vaccines and to bear with the town. And I saw that and I was like, I love this message.
Yeah, it's
And
very
Kate's
good.
been kind of helping me
Yep.
come up with ours, as well as Chief Anderson, because there's a lot of, I think they get a lot of calls there too with the Code Red program. And so I thought, you know what, I don't want the ladies in the select board and the clerk's office and the council on aging to put me on their bad list
Right.
because of the amount of phone calls they're taking. So it's like, I'm going to get ahead of that and draft a message, and maybe we can put it up with the Friday update plus channel 15,
Mm-hmm.
kind of get that out to let
How
people.
many of our first responders actually got the vaccine?
Oh, I think a lot did.
Most of them,
Yeah.
And then what is that?
Yeah.
What does most mean?
most of them did.
A good,
How many were eligible?
I gave,
All of
I
them?
gave the-
Pardon?
All of
Yeah.
them are
All of
eligible.
them.
Gee, that narrows it down. Like, how many do we have? 200,
35,
100?
35 plus 25, 60. No, that's not 60, is it?
Yes, it is.
25, 35. Yeah. You got it,
All
girl.
right. So we
Yeah,
have
60.
While you're working on the budget, Tammy, 35.
I'm better on paper. I do
all
Me too,
good.
girl. I still count on my fingers.
60 were eligible, and you think most of them took the vaccine?
yeah. Oh yeah.
Okay.
Yep. Which is great. I guess it
Mhm.
went really well in Agawam.
Right.
I'm glad
You're
everybody
the first
went.
ones in the house.
Yeah. They working with Sherry Petrucci with their health department, the public health nurse. She's been a great asset
She's
too.
awesome.
Yeah. So, if we have anything that we need to share, we've been sharing, which is, it's been good to be able to rely on. That's what I'm saying. It's like this great equalizer, this, we realize, like, not only the importance of a board of health member or a select board, like how important maintenance workers are. Everybody's kind of been elevated up and put at this level to see how well, our town runs and how important they are. Having to send people home from different departments, you realize like what their job was and how much you miss them in the sort of scheme of things and how things go. So, everybody, every little cog in the wheel that it is so important right now.
So, if we have a
So
clinic,
important.
would it be possible to offer it to the town employees first that aren't the first responders before we open it up to the rest of the public?
No, it depends on age.
Okay.
We have
all
to
right,
follow the phase unless
Alright.
there's exceptions.
Okay. Just wanted to check.
Unfortunately, they're very, very strict on that. But yeah, I mean, yes, of course, I would get town employees in as soon as we could.
All right,
But we
now,
have to
Kate,
do some
Kate-
prioritization.
all right, Kate, you're a healthcare worker. Are you eligible in tier 1 to get the vaccine?
Yeah, I'm gonna get it Tuesday,
Okay.
my first dose. Yep. Because vaccinators like school nurses, they're eligible because they're gonna be vaccinating.
And where are you going to get yours?
Agawam,
All right. And do you know which one it is?
Moderna.
Moderna.
Yep. Most of the state is getting Moderna.
Okay.
Okay. Doug, anything you need? You'd like that comment on?
Hope you feel better.
I'm all better.
Oh, good.
Yeah, actually, got my antibodies today, and I really feel better already.
I was unaware I would have called. I'm glad you're doing well.
No, my wife had a hard time, but she, since she got her antibodies, she's feeling much better. It really works, but here's the problem. Because there's a hodgepodge of testing, and there's a delay in results. If you don't get so here's how you do it. You get a positive result, you get a test, and you get the test results back. If you test positive, then you have to call your primary care doctor, and he has to call Bay State, and then they have to say that you're eligible, and then you get on a lottery list, and then they pick your name out of a hat. But because there's a delay in the test results in a lot of places, people will get their results back, let's say 5 days later. But when they go and get tested, they say, how long have you been sick? Say, well, I started a week ago, and I had a little bit of congestion, and I really wanted to write it out because I knew I had it, but I didn't want to bother, blah blah blah, or I wanted to go to work or whatever. So by the time they get into their physician, and if physician's not connected with Bay State, that's even harder. So there's a lot of antibody stuff hanging around, and people just aren't able to get in, because a lot of the nurses who are given the infusions, they're being called out because Bay State's a mob scene. They've got patients stacked up in the corridors and everything.
You're scaring me, Dr. Asia. Stop.
Well,
No, but I understand what you're saying. Once you test positive, you got to make that call if you want to get them.
You have to be your own self-advocate, because what happens is that if you go to day 11, they won't take you, because this is an FDA study, and they won't take you, and you just.
But you feel it helped you.
Absolutely, it helped. My wife was hacking all day long. It was at the point where we were going to go to the emergency room, and she turned around this afternoon, just in one afternoon, and that's been what I understand, that's been the story with a lot of people who get these antibodies.
Great.
Now, who knows tomorrow, I may end up, on a vent, but you never know.
God forbid.
I know that.
A tail, who knows, right?
But like I said, the mental stress, but there are only two people. The infusion site at Bay State, I think, has room for 4 people.
Mm-hmm.
It takes 3.5 to 4 hours to do 2 people. And the nurse was lucky at this point, because she didn't have to de-gown and gown after she went from one person to the other. But if they were 2 separate people from 2 different households,
Yep.
she'd have to change everything, and she'd take our vitals every 15 minutes. So it's a enormously complicated process.
Okay, so Jerry, now that once you recover, are you going to donate?
Yeah, absolutely. And I'm not eligible for the vaccine for 3 months.
Yeah, I know. And I've
Tell you
heard,
not to.
and so far at work, people who've had COVID and they've been vaccinated, at least with the Pfizer, have had some bad reactions.
Yeah, so they told us.
Might just be a fluke, but.
Well, they told us to wait 3 months, and because we've had the case, our antibodies should protect us for at least the 3 months. So at least that's what they're finding out. But
Right. And if you don't get that infusion, for any typical person that's tested positive, they want to get the vaccine. The only thing is that they have to be past their isolation time, and they're eligible, whatever phase they might fall in.
For the vaccine.
Mm-hmm.
Yeah, but you can't they tell you not to get the vaccine for 90 days after you get the infusion.
That's what I said.
Right, but if you
If it's
didn't
the
have it.
infusion, you need to wait 90. If you
90.
don't, then as long as you're through your isolation period, you can go get vaccinated, first dose.
Okay, so the people that were positive at Bay State, they were told they had to wait 90 days and they didn't get infusions.
That's not accurate.
No, huh?
No, it's not.
Yeah. On Tuesday, the state epidemiologist clarified that it's
Yep.
no symptoms
So I'm
Right.
as
confused
long as
here.
No symptoms.
Kate,
Wow.
I'm confused here because they told me that I couldn't, I'm out of isolation tomorrow.
Mhm.
But you
My
got
first symptoms were last Wednesday, so that's 10 days, it's tomorrow. But they told me that I can't get my vaccine for 90 days, even though
Because
I'm
you
out of
got the
isolation.
infusion.
Pardon?
Because you got the
Yeah,
infusion.
okay, that's right, all
That's
right,
the difference.
Okay.
Mhm.
yeah, that's fine.
Non-infusion people, as soon as they're out of isolation, they can get their vaccine.
So I still didn't get a good answer, and maybe Sue and Kate, you can help me with this. I got the 2-drug one, I got the 2-drug cocktail.
Okay.
What exactly does that do?
I have no idea.
Sue?
I don't know anything about the infusions.
I
Sue?
don't either.
Okay, but they also said that the reason they don't give it after 10 days is that it can do more harm than good after 10 days. They find that people actually get sicker because, that's what they told me. So, okay,
I think you should Google it.
I'm gonna. But it was a blessing,
Yeah, I don't know.
tell ya.
Okay, time to wrap it up.
Yeah, anybody else?
No.
Okay, I take a motion. Thank you, Tammy, Doug, Joe,
Thank you
Jessica.
for coming,
Oh,
everyone.
thank you.
Jessica, I
Thank
hate to
you,
pressure you
everyone.
on this. Could you get those restaurants to us, please, by the next meeting?
Sure.
Thank you. Okay, I take a motion to adjourn.
Thank
Next
you.
week, next
Good
meeting
job,
is
Tammy and Kate.
February something or other. The first,
All
4.
February 4th it is. Okay, everybody stay safe.
Thank you.
Thank
You
you.
Someone-
too.
Who
Thank you.
knows?
Bye.
Have a-
Bye-bye.
Good night, everybody.